Hey, this is Resilience Radio. You're listening to episode 6 with Joshua Singer. I'm Irvin Eisenberg, show host and owner of Resilience Occupational Therapy. As always, the opinions on this show are not necessarily shared by me. I like to have a variety of different practitioners on, and everyone has their own healthcare needs and their own opinions, and not every healthcare practitioner is going to resonate with you. Everyone has their own set of needs. Also, none of this is meant to be diagnostic or prescriptive in any way, so please seek out your own healthcare practitioner before acting on any of the advice. So my guest today is Joshua Singer. He has been a licensed acupuncturist for almost 20 years, where he has been caring for our Central Vermont community using a variety of tools from Chinese medicine. Good to have you on today, Josh.
Thanks, Irvin. Good to be here.
Could you tell us a little bit about yourself, your hobbies and passions?
Sure. My passions mostly revolve around my daily life of caring for my family and my patients. My family life is just a big part of who I am and what I put my energy into, and as well as my work life, caring for my patients. I have an 18-year-old daughter, a 15-year-old son, an 11-year-old daughter, and a wife of 21 years. So there's a lot of focus on that, and like holiday time is coming, and we're already having a lot of fun. Personally, I enjoy certain activities, particularly playing tennis has been sort of a lifelong joy of mine. I don't get to do it as much these days, as well as downhill skiing. I really enjoy being on the mountain. And another thing I enjoy greatly is being on the lake. When I can. I have a canoe that was my grandfather's when I was a kid, paddling with him, and I kind of inherited it and fixed it up. And I try to use that when I can on Lake Champlain, where my folks have a place. And I enjoy being on the lake. That really settles my inner self very quickly. I think that's all I got for you for now.
Okay. Could you tell us what acupuncture is?
Sure. That's a long one, but I do practice that in the treatment room, trying to help patients understand that. One way I would explain, well, to broaden it, acupuncture is part of a broader system of medicine we call Chinese medicine, or more specifically, traditional Chinese medicine. That's a term that was a term created by Mao when the Cultural Revolution happened in China. And he created traditional Chinese medicine, sort of defined the way Chinese medicine was going to be mostly taught out of China. There are other forms, there are other styles and broader forms throughout the country, the world. But traditional Chinese medicine is considered to have 5 branches or tools of its medicine. One of them is acupuncture. One of them is nutrition. One of them is a massage, or we call tuina. One is exercise, and one is herbs, Chinese herbs. So acupuncture and really all these forms are tools to help regulate the functioning of the body, I guess, as any medicine does. Chinese acupuncture and these tools of Chinese medicine are using the Chinese medical understanding of the body to help regulate its functioning, of course. So these acupuncture is using the use of very fine stainless steel solid needles. Almost maybe a few of our hair follicles wrapped together could be an acupuncture needle. They bend real easily. So we stimulate with the needle certain points to help influence the functioning of the body. We've learned more modernly that it can reduce inflammation locally. If I have inflammation in my shoulder, by stimulating that point, it'll initiate an anti-inflammatory response. So we know that acupuncture causes some local effects, but it also can regulate the functioning of the internal organs. So if the stomach is producing excessive acid or not producing, and we can stimulate certain points to influence the organ function. So a general way to say it is that acupuncture is using fine needles, stimulating certain points to help regulate the normal functioning of the body. Stimulating the body's own mechanism to do that.
So when you work with patients, you're doing a combination of these different modalities of Chinese medicine.
Right. That's right. I'm using these tools from my experience, from the thousands of years of experience. I'm using these tools when they're called for in the treatment room. Mostly, I'm personally using acupuncture. Pretty much everyone, not every single person I see, but some people we just use herbs. But I use acupuncture on most people. I use herbs with maybe less than half of my patients. We prescribe an herbal formula. We use various forms of herbs. Some of them are custom made granular powders that we combine and people drink a tea. So we often use herbs, and I use short massage. We call it Tuina, which is a few different techniques, like a rolling kind of technique we'll use. So I incorporate that, as well as giving nutritional advice according to Chinese medical understanding. And sometimes I instruct people on certain qigong activities to strengthen the body. So yes, I do use a variety of those.
Okay. And would you refer to yourself as an acupuncturist or as a traditional Chinese medicine practitioner? What would be the correct title?
Right. I think, like you say there, a practitioner of traditional Chinese medicine is actually the most accurate way to say it, but it's kind of long tongued there, and people don't really know what that means. So, acupuncturist has sort of been the word I think we've adopted in our culture to explain what I do. Some acupuncturists have been more trained in herbs, for example, than others, or have been trained in massage. My training is real diverse, so I use those tools. Some acupuncturists only use acupuncture. So it's a question like you ask. If somebody says they're an acupuncturist, it's a appropriate question to say, do you also use Chinese herbs? Do you do massage? In China, the acupuncturist usually just does acupuncture, while the herbalist just does herbs, while the Tuina practitioner just does Tuina. So they're a little more specified in China than we are in our country. Maybe there's advantages to that. I'm not sure, but it is a confusing term.
Okay. And it's my understanding that you studied and did some pre-med prior to your your decision to become a Chinese medicine practitioner. What led you down this path?
Well, I've always been interested in the body. Human biology is just a natural interest of mine, and not everybody's, but I've always been interested. Even in the Western medical understanding on a cellular level is just an interesting thing. Incredible, really, that we've understood the body the way we have. So when I went to college, I quickly became pre-med and graduated pre-med. I took the MCAT to potentially go to medical school, but around my third year, I did take a break and I did some traveling. I wanted to see what else was out there in the world, and there was a program that took a ship for 3.5 months and traveled around the world for that time, stopping in different countries. So that really opened up my mind to different ways of doing medicine, healing, different perspectives, in the world, different value systems of cultures. Just sort of opened my mind up to, we don't understand everything here. We understand what we've learned. So what else is there out there? So I was really drawn to China, and after about a year after I graduated college, I moved to China and lived there for the year, and got to teach English and study Chinese language, and also observe kind of informally in the hospitals doing acupuncture, and did reading and sort of just try to jump into Chinese medicine within its culture. And then after that, went to school in Portland, Oregon, the Oregon College of Oriental Medicine, a master's program, which most licensed acupuncturists go through a master's degree. And there are more than you imagine, actually. There's like 30 different schools in our country, maybe more, that teach Chinese medicine. So after that, I got my master's degree and moved to Vermont with our daughter was just born. I think she was 6 months old. She's now 18 and started to practice here. And it's been a learning experience since.
So why Vermont?
Right. Well, I grew up in Pennsylvania, outside of Philadelphia, and when our daughter was born, we sort of wanted to be closer to family. And we would come up here to Vermont in the wintertime, often to ski at Okemo, actually. My father would take us up from Pennsylvania, drive up on the weekend. So I kind of had that, affinity like a lot of us do for Vermont. And, Portland was sort of a bigger city to us, and we wanted to raise our family in a smaller community. And so we just sort of found our way to Montpelier and started up, and it's been a great place to raise a family, a great place to practice our medicine. It's been a community, like that's been open to more complementary styles of medical care, and I've really appreciated that, and I've enjoyed being in this community. And it's sort of been an honor to, like as well, it's sort of an honor to care for people.
Could you speak to the fact that you have a very sort of American version of acupuncture, being studying a master's program in the United States, but that year before you started school, that year in China, how does that affected your practice and your perspective as a practitioner?
Right. Good question. It really has, actually. Spending that year, I felt was important to do personally before learning and sort of adopting a medicine that evolved for thousands of years in a different country. It felt like responsible for me to be there and see it within its own culture, and to really understand it. To take something out of its context is hard to fully understand it. So to me, that was important, and it gave me perspective on the medicine, just the culture itself. Of course, medicine evolves within its culture, just like language, and they influence each other. So the Chinese culture has a different perspective, even on, like, as an example, the sort of in our culture, we often separate things in the body. We think of things in a separate kind of system, and even each other we're very thought of and very individual and separated from each other, and our even our economic system is very based on individual often. So Chinese medicine, Chinese culture is different. I observed that it was a little more of a group mentality, and the individual was a little less significant than the way we feel ourselves here. An example I think of is even the birth date. Like, I remember they didn't really celebrate a birthday. They celebrated the birth year. I was born in that year. It's like I graduated in this year from high school. That's what defined me, the group, not necessarily me. So that's kind of what I took from that. And the medicine evolves within that context. So understanding the body as a whole system, even part of the natural world, being a piece of the natural world, not completely separated from it, as we think of ourselves as this unique person separated from you. And so that medicine understands that the body is not so separated, and for thousands of years has practiced the medicine with that understanding. So when I, as an American-minded person, that I had to sort of, and also a pre-medical student, I had to sort of, really take that in and try and understand that. And being in the culture itself has helped me understand the medicine to maybe a deeper degree, because of that, understanding the more holistic perspective. This gallbladder is not necessarily separated from the liver. Maybe physiologically we can separate it, but within the body, we can't necessarily look at them separately. Even the emotional self, it can't necessarily be separated from the body. They really influence each other, and can't really tease them apart so much. So when interacting with people in the treatment room, I have that perspective, maybe in a deeper way because of my Chinese experience. It was only a year, but it was an influential time for me. Also, the time learning the language there helped me feel more natural with the medicine, because the herbs are in Chinese. I know them in Chinese names, and the teachers were Chinese in school. It was more natural for me to interact with them and understand them, their English stuff. So I think it really catapulted me through school in an easier way because of that year, and just really influenced my understanding. I'm really grateful and sort of proud that I did that. We planned on actually going back to China when I finished, but our daughter was born and we kind of grounded here.
Mm-hmm. So here's this medicine from the other side of the world that's developed in a very different cultural context over thousands of years, and then you come in as a pre-med student, very steeped in Western medicine, um, and you're bringing it to Vermonters. Where do you feel that there are, in some ways, the cultural nature of the medicine is a mismatch in some ways, or in what ways do you feel like it augments and helps people,
Yeah.
and where have your challenges been in sort of translating this culture?
Yeah, that's a great question, Irvin. I appreciate your thinking about it that way. It is a real challenge, and yeah, we have to adapt. We have to adapt. I've had to adapt the understanding of the medicine to the patients I'm bringing it to some degree. When I'm communicating about it, like I am trying to here, sometimes I don't go into this depth. How does acupuncture work? Sometimes it's very simple, or talking about what's wrong. Why is this wrong in the body? According to Chinese medicine, it's kind of a longer, confusing explanation for people. So I often don't even, like, we haven't even talked about the word energy here, because that sounds like, what does that mean? It's in Chinese culture. In Chinese medicine, qi is a big part of what we're doing, but in our mindset, we can't relate to it so much. So I often don't use that language, and try to explain it to people according to what we already know. So it is actually a struggle, for me. It is how to not lose that holistic, Chinese minded perspective while being an American. In the meantime, I have to recognize I'm American mind, and I'm living in America most of my life, and I'm around all mostly Americans, and so so we have to adapt it a little bit. And I think we've done that. I mean, historically, that's kind of what happens. Historically throughout the world, we sort of adapt things from other cultures, and we adopt them, and then we adapt them a little bit. But we don't want to completely lose the context. So it's a good question, and I think if you talk to other practitioners of Chinese medicine, you would. It's a good question to see how they deal with that. And for me, I try to keep my feet in both places. And if I'm communicating with a Western medical provider, a doctor, I just kind of speak in more Western medical terms. But in my heart, and in my intention, in the treatment room, it's very Chinese minded, I guess you could say.
Mhm. And of course, when people say acupuncture, they often sometimes people view the entire East as sort of a monolith of, oh, that's where they practice acupuncture. And I know that there's Korean acupuncture and Japanese acupuncture. And then you've talked about the fact that what we're calling traditional Chinese medicine is really uh, communist Chinese and and to present
Yeah.
Chinese medicine. Where do you stand in that sort of broader tapestry of acupuncture and sort of Asian medicines in your practice?
Yeah. Yeah. Some people have wanted to change the term to East Asian medicine. Some states have decided that's what we're calling this medicine. Sometimes states have decided we're calling it acupuncture medicine. So that the language has been challenging. And like you're saying, it's not just from China. There's this, like we practice acupuncture in Japan and Korea and Vietnam and everywhere. And Israel has a strong practice of acupuncture in Europe. So, but there are also, what you're saying is like classical Chinese medicine predates traditional Chinese medicine. It's a little broader perspective. And we have what we call 5-element acupuncture, which is a little more based on spiritual and emotional perspective of this body, and using acupuncture to influence that aspect of us. So I personally, in my practice, is mostly the way I was trained in school, and I have adopted other of those forms a little bit here and there that influences my mind and my choice of points in the treatment room. So for me personally, I kind of don't understand some of the fullness of, for example, classical Chinese medicine. I see it as a broader use of the channel systems, and I personally have found traditional Chinese medicine I've sort of focused on that, and I've found it to be effective with people. And it's enough for my brain to play with every day. So
if you were to have another year of study, and you could choose any aspect of either acupuncture under the broader term or traditional Chinese medicine, what would you want to focus on? What do you feel like where you would like to see your practice going if you were sort of forced into going back to school for a year?
Yeah, that's a cool question. I think what I would want to do is spend the time getting more effective with my patients. I would want to say, well, my goal is to be more effective, really, as effective as I can be. So I would think, well, where are my struggles? What am I seeing the struggles with, and what is my interest? I think, it's a hard question. If I had that time, I think, my interest, I would say, is in 5-element acupuncture. I'm personally quite interested in human beings in general, but especially their our sort of spiritual, emotional, behavioral stuff. I'm just interested, and I think understanding the human from that part of us, from a Chinese medical view, deeper would be interesting. So I may jump into that. I did spend a couple year training with Lonnie Jarrett, who is a well-known acupuncturist in Western Massachusetts, who helps integrate traditional Chinese medicine and 5-element style. He does. He wrote a couple big texts for us. Clinical Integration, Nourishing Destiny is a big book that a lot of us know. That Lonnie happens to live in Western Mass, and he offers kind of a training. So I did that almost 10 years ago, and maybe more. And so I think I would dive deeper into 5-element acupuncture. And in Montpelier, we happen to have a few practitioners who just do 5-element acupuncture. And I often refer to them, for folks who I think need that kind of care. But I'm going to keep thinking about that question. I may have to get back to you.
Okay. So within sort of the tapestry of Montpelier and Central Vermont healthcare practitioners, there's a few different acupuncturists and Chinese medicine practitioners in the area. What makes your practice unique?
Mm-hmm. Well, I think the uniqueness may be in the provider themselves. I think the person who's providing the care, whether that's your primary care provider or your your structural integrator or your acupuncturist or whoever. I think the actual person and what they bring themselves to the treatment room, I think that's the unique part. So what makes my practice unique, I guess, is me to some degree. I'm kind of a humble guy, so it's hard to say. But I think I'm a good listener to my patients. So I'm interested genuinely in what's going on, and I think there's a genuine caring that happens, and it's easy to be present here. It's easy for me to sort of block everything else out and be right here, and I'm just sort of interested naturally as to what's going on for them, physically, emotionally, spiritually, whatever's going on. Sometimes the problem is actually on a more their stress that's rooted in their heartburn is really coming from the times they're stressed. So we have to look at that, and not that I'm a therapist or a counselor, but I can listen and understand kind of what's going on there for them, and use the view of Chinese medicine somewhat to help move that kind of stuck part for them. So that's what I can say is unique.
So the idea of getting needles and put into you is makes many people apprehensive who don't have experience with it. My minimal experience with acupuncture, it's been the needles. The anticipation of the needles was a way bigger deal than the actual sensation. In some cases, it was like, wait, is it in yet? But the practice of let me rephrase that question. So for the apprehensive person who's made a little nervous about the idea of having acupuncture and you're going to put needles in me, and that being worrying, and somebody who's not used to experiencing medicine outside of the culture that they already are in, what do you do to put people at ease? What can someone expect in their first session with you?
Right. Well, I tell them, like, we'll just do one and you see how it feels. And if anything's uncomfortable, we won't do any more. Just so let them know that they can be in power here. I'm not going to just stick needles if they're uncomfortable. We're going to do this together. So knowing that I'm listening to them and aware of their anxiety, and communicating about that is important. I tell them the needles are really fine. Like like you said, you often don't perceive them. That usually doesn't do anything for them. It doesn't matter. They're still nervous, I show them that we use these little plastic tubes, and the tube sort of distracts the skin. So you actually often don't feel the needle because of the tube. And then I describe for them what they may expect. They may feel the tiny tip of the needle. They may feel a little pressure sensation, or a little fullness. So they have an idea of what they may feel. And we just do one and see what it's like. And sometimes we just do a couple, 3 needles, 4 needles, and that's all for the first visit. So I try to tell them I try to describe what the sensation is so they know what to expect. Some people want to see the needles, some people don't. But like you said, most people who have apprehension, they don't after the first needle or the first treatment. They realize what it is, and it's more in your mind. Just like this COVID test is kind of in my mind. Oh gosh, sticking this thing up my nose, that's going to. But really, people say it's no big deal.
Okay. So I know that you do some work at the National Life Cancer Treatment Center in Berlin. Could you speak a little bit about that?
Sure. I really enjoy working up there as part of the team of providers. Although I haven't been since COVID time, since March, because they're limiting patient flow and however they can up there. So I see cancer patients and they refer them to my office now. But for the past 10 years, I've been going there a couple half days a week, supporting patients through their cancer care. Most oncology centers, the major cancer centers in our country, have acupuncture available. They actually have done a really good job. I think the field of oncology has done a great job at more integrative medical care. I think because of the challenge we have treating cancer, they've really sought out other forms to support the body and make it easier to go through treatment. So we often see acupuncture, massage therapy, Reiki, stress management, meditation sort of programs at cancer centers. And here at Central Vermont Medical Center, they've done a great job at creating, and I think it's a unique thing in Vermont, they've done a great job at creating an integrative experience. So I'm there with acupuncture, supporting people through their struggles. And sometimes that is simply treating anxiety and sleep struggle because of the stress. Sometimes it's like local pain, like if you're getting treatment on the breast, you need to hold your arm up. And people who have shoulder arthritis, it may be painful to do that for 15 minutes. So we try to treat something like that to make this easier. People often feel fatigued going through radiation after a few weeks, and we try to minimize the fatigue. Sometimes I'm treating people at the chemotherapy suite when they're getting their infusion, for example. I'll put needles there when they're waiting with their infusion. Often it takes an hour or two. So the research shows that if we do acupuncture within 24 hours of the chemotherapy, we can reduce some of the side effects. So we're treating various things or trying to prevent things like neuropathy in the hands and feet is a common side effect of chemotherapy, certain chemotherapy. That's a big one we're trying to prevent. The nausea or loss of appetite can be really restricting for people because then they're not eating regularly and they're not getting nutrition, and it's harder for them. So that's one of the most important things I see treating is if there's dry mouth from the radiation that limits them or nausea, we want to make sure they keep getting their nutrition. And so we're using acupuncture like this to make the treatment as effective as it can be, so we don't have to reduce the chemotherapy because of the side effects or shorten the radiation because of, we want to keep the body as healthy as we can to go through this and get the most effective treatment for their cancer. And so for me, it's a real joy. People say, is it hard to treat people with cancer? But I find, it's a joy to support people, especially when they're struggling, and you can really be there for them. And I have a tool that can be supportive, and the staff there, the doctors, the nurses are all supportive of this, and I'm really proud to do that.
Well, it sounds like some great program.
Yeah.
Do you feel oncology has sort of been more receptive to alternative medicines and medicines of other cultures? Why do you think that is?
I think because of the sort of the challenge we've found treating it. Like we've figured out how to replace the hip, we've figured out, I think it's a field of medicine that we've just struggled with. And there's been so much research into cancer, and people die from cancer more than they do the hip, osteoarthritis. You know what I'm saying? I'm saying I can't think of the right words, but I think it's such a threatening disease, and it's something we've been challenged to deal with. So I think this is just my thinking. I think they've been open to finding what else can we do to manage, especially side effects of treatment. I think the treatments are really intense. Chemotherapy can really be hard for the body, and they've just sought out. They've been open to what else can we do to help people with their nausea, because this medication is not quite enough to deal with the nausea or whatever. So that's my understanding. I kind of be interested to read a little bit more of the history when acupuncture was incorporated in the hospital system. There's a good hospital, Memorial Sloan Kettering in New York, that is a cancer center, and they've done a lot of great research around acupuncture and Chinese medical care. And they have programs. If I wanted to study there, for a residency, I could and learn even more extensive use of acupuncture with cancer care. So I'm impressed with that place particularly.
So it seems like acupuncture has made its way into oncology within our medical system and sort of is more accepted there. Where do you see acupuncture potentially going next? Where do you feel like there is a need within our society or our medical system that, with your experience of what acupuncture and Chinese medicine can do, would be useful, but we're not quite there yet?
Right. Great question. I feel, and I guess I'm biased, but I feel like acupuncture can be helpful. It's another, if you think about acupuncture as a system of medicine that has been used for thousands of years as like the main form of medicine for a good large population of this planet, whatever, it's just been used as a main form of medical care. So for digestive issues or for pain issues or for respiratory issues, this medicine has been used effectively over the years. So my feeling is that it would be great to have acupuncture within the primary care setting. And for some time, I was part of the Montpelier Health Center as an integrative practice that didn't fully integrate as I would have liked to see. It was a little difficult in that way, but I'd like to see acupuncture. I think the first place that we could see it is probably in pain management. Arthritic conditions like in rheumatology or just like managing pain. I think we have the most research scientifically around pain management in acupuncture. So the Western medical world likes scientific research. So I can see it being incorporated initially with pain management. But I'd like to see it in primary care in general, as a provider there, I'd like to see massage therapists there, an acupuncturist there, a chiropractor there, and everybody sort of working together. In my office here, we have a little bit of that. Upstairs, I have a naturopathic physician, a psychologist, and a massage therapist that we do try to work together with our patients to support them from those different angles and in a more integrative way.
Yeah, one of the goals of this podcast is just giving people, if nothing else, the resources of different perspectives, either of Central Vermont and Vermont practitioners, or just ideas they might not have thought of before, just to help build the overall resilience for people taking care of their own health and seeking out their practitioners. But of course, when you have those opportunities for direct collaboration between medical healthcare professionals, it's always sort of a great opportunity for really giving support in a lot of different ways.
Yeah, I appreciate you doing this show for that purpose, and I do think that patients really appreciate when their providers are communicating with each other, whether they're used to the specialist and the primary care, but it's more effective for like a patient to be at the center of the circle of providers and for everybody to be communicating about what's going on in their perspective. It's better care. I think we're not quite set up to do that in our medical model, but I'd like to see medicine move in that way for sure. Insurance gets in the way, payment and all that gets in the way, and we're not quite set up for it yet, but I hope to see that in the future. Maybe we can make that happen.
Well, thank you so much for joining us today. Do you have any parting advice or thoughts for the listeners?
Not really, not necessarily. I kind of wish everybody, like, I know in the treatment room, we're all kind of anxious right now. So I just wish everybody a sense of like calm and peace right now over these next few months. And I appreciate you all listening to what I have to share and for Irvin doing the show. That's all I can offer. I wish just peace for everybody through all this time.
I really like how Josh shared his perspective on Chinese medicine, having been to China and seen the medical system there and being actively involved in the medical system here. Just hearing those differences and how a practice that's developed so long ago in the other side of the world can be applicable to us here. If you enjoyed this episode, please like it on the podcatcher of your choice and maybe share it with a friend. You've been listening to Resilience Radio. I hope you enjoyed.